My dear viewers, we have Dr. Sridevi with us. Today, from Dr. Sridevi, during the first 3 months of pregnancy, the woman can have a bleeding. They get very upset. Can you be able to share what are the causes of bleeding in first 3 months of pregnancy? Please.
Thank you. So this bleeding can be very alarming sometimes because you're so happy that you're pregnant, and suddenly when there's a bleeding you get very anxious. So now coming to the causes, what can be the causes of this first trimester bleeding? First, we call that as an implantation bleeding, which occurs earlier itself. Like normally maybe after like 5 to 10 days, sometimes you may have just little bit of bleeding and it stops the next day. So that's how you differentiate it from whether periods or whether it's an implantation bleeding. Not necessarily it should occur in everybody, but there's a possibility for you to have an implantation bleeding. Next, coming to the more important causes, one can be an abortion. So what is this abortion? That is, suddenly what happens is the baby comes out. That is expulsion of the baby before even it attains its full maturity. So this abortion can happen in the first 3 months. It's very common. And if the cervix os is opened, then there is complete expulsion. Whereas if sometimes what happens is there is bleeding, but if the os is closed, then we just tell it as a threatening. It's a threatened abortion.
Yeah, the os, just 1 minute. The os is uterus, the cervix, uterus attached to cervix. That's the front part. That is normally closed. That's what we call, the opening is called os. Yeah, please continue.
Yeah. So that cervical opening, which we call it as the os, if the cervical os is closed, then immediately when you have bleeding, they will do an ultrasound and they will check. If the os is closed, it is a threatened abortion. That means it's threatening, it's going to abort, but still you're still safe, the pregnancy is safe. And you should just be careful that again it doesn't come. Now, if the opening is open, then what happens is sometimes the products may come out. That's why we don't want to do any strenuous activity or any abnormal activity in the first 3 months, because once the os, that is the opening, is opened, then there is nothing we can do. It starts coming out on its own. So that is about abortion. Then there are some other causes where there will be bleeding. One is ectopic pregnancy, we call that. That is normally what happens is the implantation, that is the fertilized ovum, that is with the sperm and the ovum, when it becomes an embryo, it has to get implanted in the uterus only. That is, other than the uterus, sometimes what happens is in the tubes itself, it will get implanted. So what happens when it starts growing, that only we call it as ectopic pregnancy. For that, the bleeding will be very excessive. So you have to be more careful.
Is inside. If the rupture ectopic, inside bleeding will be more. But outside coming, it not necessarily be more.
Bleeding. Sometimes pain alone itself also can be there, and associated maybe with minimal bleeding, but the patient may actually have hypotension like that. The other symptoms of bleeding may be more. So you have to be very careful with ectopic pregnancy, which is a medical emergency where immediately it has to be treated. Another condition, we call that as a hydatiform mole or a vesicular mole. That is, in the placenta, what happens, there's degeneration of the chorionic villi, that is, it starts growing more. That condition, we call that as hydatiform mole or vesicular mole. In this also the bleeding is more. Then how can we differentiate what is the cause of this bleeding? So this bleeding, if it is painful, then we have to think whether it's more in terms of an abortion or an ectopic pregnancy. And what is the general condition? In ectopic pregnancy, sometimes the general condition of the patient will be very bad. When we call general condition, we say the patient will be in shock, they will feel very weak, suddenly they will just fall from, and the bleeding will be very sudden. So this, how we can differentiate. And with the help of ultrasound, we know exactly whether the pregnancy is implanted somewhere else, that is an ectopic pregnancy, or whether it's because of the products are going to come out, that is abortion. Sometimes minimally they can just have a spotting, we call that as subchorionic hemorrhage. In those conditions, they may have a small clot when the baby and the placenta is getting formed. That time there may be a small clot. If it is less than 1 centimeter, usually it is nothing to be worried, but it has to be careful because it doesn't increase or it doesn't progress. So in future scans, we will measure the size of that. In that condition also, they can have a bleeding in the first trimester. So we have to do an ultrasound first. Immediately it has to be checked because why is there bleeding? And so depending on these three conditions, it can be treated as what has to be done.
Yeah, beautiful. To consolidate, it could be implantation bleeding, it could be something with abortion, or it could be an ectopic pregnancy, that is pregnancy somewhere other than the uterus, or it could be vesicular mole or hyalitiform mole. The patient will tell the history of passing like vesicles or grapes. These are the conditions and it has to be attended immediately. Okay, doctor? Okay, thank you very much.
Thank you.